So let us talk about Chalazion today. Chalazion is defined as a chronic inflammatory lipogranuloma of meibomian gland. Now let me explain this with a diagram first so that we can have a much better understanding of how it develops and how it presents. Eyelid, there are a number of meibomian glands. Now meibomian glands are one of the few glands which are present in the eyelid. If any of this gland gets obstructed because of any infection, it will result into an accumulation of that gland with its own secretion, and this will present in the form of a chalazion. So chalazion by definition is defined, as I said, chronic inflammatory lipogranuloma of meibomian gland. So as you could see in this diagram, I have labeled this as a meibomian gland. So you could see that if the orifice gets obstructed by any infection, there will be accumulation of sebaceous secretion. Now this accumulation of sebaceous secretion will lead to an inflammatory reaction which will be accompanied by epithelioid cells, joint cells, lymphocytes as well as neutrophils. Now these inflammatory cells will result into an inflammatory reaction that will present in the form of a clinically visible swelling in the eyelid termed as chalazion. Now chalazion can lead to a number of complications, and they include mechanical ptosis as well as astigmatism. Now talking about clinical features, chalazion appears to be more abundant in the upper eyelid and it presents in the form of a painless swelling. In the form of a painless swelling, it will cause eversion of the eyelid and eventually covering the eyelid, causing blurring of the vision. Now as you could see, this is a chalazion, which is a swelling in the upper eyelid. Now this will not only be causing a nodular swelling, but it will be causing a swelling of whole eyelid, whether it is present in the upper eyelid or in the lower eyelid. Now talking about the fate of chalazion, it can either resolve spontaneously or it can fibrose into a hard nodule. It can either liquefy into a cyst or calcify or eventually become infected. Now talking about the treatment, if it is small and recent, only hot fermentation, topical steroid antibiotic combination drops or anti-inflammatory drops will resolve it. However, if it is large and it is persistent, then we will prescribe the patient with a corticosteroid injection, that is triamcinolone acetonide, or if it is still not treated properly, then incision and drainage is the ultimate treatment for removing chalazion from the specific eyelid in which it has appeared. So I hope now you have a much better understanding what chalazion is and how it presents. Thank you.